10 signs of cardiac problems that can lead to death. Your body often sends subtle yet crucial signals when something isn't right with your heart. Being aware of these warning signs can be life-saving. Heart disease remains the leading cause of death globally, responsible for approximately 17 million deaths each year. Early detection is key to prevention, and that's why in today's video, we'll uncover 10 visible signs that may indicate heart problems and 10 proactive tips to strengthen your heart and prevent future issues. We encourage you to watch this video until the very end, as each sign and prevention tip is essential for maintaining a healthy heart. The more people engage with this video, the wider its reach on platforms like YouTube, making it accessible to those who may not have easy access to healthcare. By liking and sharing this video, you play a role in spreading life-saving knowledge. If you or someone you know has experienced heart-related issues, we'd love to hear from you. Drop a comment below and let us know where you're from. Your story might help others become more aware of their heart health. Now, let's dive into the first critical warning sign. 1. Swelling in the feet and legs, a sign of fluid retention. If you notice swelling in the feet, ankles, or lower legs, this could be a sign of fluid retention, edema, caused by heart dysfunction. The heart plays a crucial role in circulating blood efficiently, and when its function is compromised, fluid can accumulate in the tissues, particularly in the lower extremities due to gravity. Edema related to heart disease is commonly seen in congestive heart failure, CHF, a condition where the heart struggles to pump blood efficiently, leading to fluid buildup in the legs, lungs, and even the abdomen. Peripheral arterial disease, PAD. Poor circulation due to narrowed arteries can cause swelling and pain in the lower limbs. Deep vein thrombosis, DVT. A blood clot in a deep vein, usually in the legs, can cause painful swelling, warmth, and redness. In some cases, swelling may start gradually and worsen over time, while in others, it may develop suddenly and severely. If you notice persistent or worsening leg swelling, along with symptoms like fatigue, shortness of breath, or chest discomfort, it's critical to consult a healthcare provider immediately. 2. Cyanosis. When your skin turns blue due to lack of oxygen. A bluish tint on the lips, fingertips, toes, or mucous membranes is known as cyanosis and is a serious sign of reduced oxygen levels in the blood. This occurs when the heart is unable to pump enough oxygenated blood to the body, leading to tissue oxygen deprivation. Cyanosis can be observed in conditions such as congestive heart failure, CHF, a condition where the heart's pumping ability is weakened, leading to blood pooling in the lungs and extremities. Congenital heart defects, structural abnormalities present from birth that cause an abnormal mixing of oxygenated and deoxygenated blood. Severe lung diseases like COPD or pneumonia. These conditions reduce the oxygen supply in the bloodstream, leading to cyanosis. Cyanosis may first appear as bluish or purplish discoloration on the nails, lips, or skin, but in severe cases, it may extend to the face and entire limbs. If you notice sudden or persistent cyanosis, seek emergency medical care immediately, as this could indicate a life-threatening heart or lung condition. 3. Non-healing sores, a warning sign of poor circulation. Persistent sores or ulcers on the legs, feet, or toes that fail to heal properly can indicate poor circulation, often due to blocked or narrowed arteries. These ulcers are commonly associated with peripheral arterial disease, PAD, a condition where atherosclerosis, plaque buildup, restricts blood flow to the lower extremities. Individuals with PAD may experience additional symptoms such as leg pain or cramping, especially when walking or exercising, coldness or numbness in the feet, shiny, smooth skin with reduced hair growth on the legs, slow healing wounds or ulcers that become infected or darkened. There are 2 main types of leg ulcers related to circulation issues. 1. Arterial ulcers, typically found on the outer areas of the feet, heels, and toes. They tend to be painful and result from severe arterial blockage. 2. Venous ulcers, more common on the inner side of the leg, often linked to varicose veins or venous thrombosis. They may appear swollen, red, and prone to bleeding. People with diabetes are at an even higher risk of developing painless ulcers due to diabetic neuropathy, where nerve damage prevents them from feeling pain, even if an ulcer is worsening. If you or a loved one has a non-healing sore, seeking immediate medical evaluation can prevent severe infections, tissue damage, and potential amputation. 4. Arcus senilis, a sign of high cholesterol? Have you ever noticed a white, gray, or bluish ring forming around the outer edge of the cornea in someone's eye? This condition, known as arcus senilis, is a cholesterol buildup that commonly occurs with aging. It starts as a crescent-shaped deposit above and below the cornea, gradually forming a complete ring over time. In older adults, above 60 years old, arcus senilis is considered a normal age-related change and is not typically linked to heart disease. In fact, nearly 60% of people over 60 develop this condition, and its prevalence approaches 100% in those over 80. However, if arcus senilis appears in younger individuals, under 45 years old, it may signal a more serious health concern: severe dyslipidemia, a condition characterized by high cholesterol and triglyceride levels in the bloodstream. Studies have shown that premature arcus senilis is strongly associated with an increased risk of cardiovascular disease, heart attack, and stroke. If you're under 45 and notice arcus senilis, it's essential to undergo cholesterol testing and cardiovascular screening to determine whether lifestyle changes or medical intervention are needed to protect your heart health. 5. Shortness of breath, a silent heart warning. Experiencing unexplained shortness of breath, especially during light activities or while lying down, could be a key indicator of heart problems. The heart's primary function is to pump oxygen-rich blood throughout the body, ensuring that every organ, including the lungs, receives adequate oxygen supply. When the heart is weakened or struggling to function properly, blood flow becomes compromised, resulting in less oxygen reaching the lungs. This condition, known as dyspnea, can make even simple activities like walking upstairs or lying flat in bed feel exhausting. Shortness of breath is a common symptom of heart failure, where the heart fails to pump enough blood to meet the body's demands. It can also occur due to coronary artery disease, CAD, where plaque buildup in arteries restricts oxygen-rich blood flow to the heart, leading to a sense of breathlessness. In severe cases, individuals may experience sudden, severe breathlessness at night, paroxysmal nocturnal dyspnea, forcing them to wake up gasping for air. If you or a loved one notices persistent difficulty breathing, especially when resting, it's crucial to seek medical evaluation immediately, as this may indicate an underlying cardiovascular condition requiring urgent attention. 6. Xanthelasma, cholesterol deposits on the eyelids. Have you ever noticed yellowish patches on someone's eyelids? These fatty deposits, known as xanthelasma, are visible indicators of high cholesterol levels, which significantly increase the risk of heart disease and stroke. Xanthelasma is commonly seen in middle-aged adults, particularly those with dyslipidemia, a condition marked by high cholesterol or triglyceride levels. While these soft, yellow plaques are harmless from a cosmetic perspective, they should be treated as a red flag for cardiovascular health concerns. If you have xanthelasma, it's essential to undergo cholesterol and lipid screenings and adopt heart-healthy lifestyle changes, including dietary modifications, regular exercise, and medical intervention if needed. 7. Hair loss on the legs, a sign of poor circulation. If you've noticed patchy or excessive hair loss on your legs or feet, this could be a warning sign of peripheral arterial disease, PAD. PAD occurs when arteries become clogged due to atherosclerosis, restricting blood flow to the lower extremities. As a result, your hair follicles do not receive enough oxygen and nutrients, leading to hair thinning or bald patches on the legs. In severe cases, individuals with PAD might also experience cold feet, numbness, leg cramps, or slow-healing wounds. Since PAD is closely linked to coronary artery disease, recognizing this symptom early could help prevent heart attacks or strokes. If you observe unusual hair loss on your legs, it's advisable to get a vascular health assessment. 8. Abnormal heart palpitations, when your heartbeat feels off. Do you ever feel like your heart is fluttering, skipping beats, or racing unexpectedly? These irregularities, known as palpitations, can be triggered by stress, caffeine, dehydration, or hormonal changes, but they can also signal serious heart conditions such as arrhythmias or atrial fibrillation, AFib. AFib is a condition where the heart beats irregularly, increasing the risk of stroke and heart failure. If you frequently experience unexplained palpitations, dizziness, or chest discomfort, seeking medical attention is crucial to rule out underlying cardiovascular issues. 9. The Frank sign, a subtle ear crease that could indicate heart disease. Did you know that a small diagonal crease on your earlobe could be linked to heart disease? Known as the Frank sign, this physical marker was named after Dr. Sanders Frank, who first identified its connection to coronary artery disease, CAD, in patients with chest pain. The presence of a diagonal ear crease has been associated with atherosclerosis, a condition where plaque builds up in the arteries, restricting blood flow to the heart. Researchers believe this crease develops due to impaired blood circulation in tiny capillaries, which might also reflect similar blockages in larger arteries. However, while the Frank sign is not a definitive diagnosis, studies suggest that people with this feature should undergo cardiovascular screenings to detect potential risks early. If you or someone you know has this visible marker, consulting a doctor for further heart health evaluations is a wise step. 10. Excessive sweating, a silent heart warning. Sweating is a normal bodily function, but unexpected, excessive sweating, especially in cool temperatures or without physical exertion, could be an alarming sign of an underlying heart issue. When the heart struggles to pump blood efficiently, it may trigger a stress response in the nervous system, causing the body to perspire excessively as it attempts to regulate temperature and compensate for poor circulation. This phenomenon is commonly associated with heart failure and angina, a condition caused by reduced blood flow to the heart muscle. Excessive sweating related to heart problems is often accompanied by chest discomfort, dizziness, nausea, or shortness of breath. If you notice persistent or unexplained sweating, particularly at night, it's crucial to consult a healthcare provider immediately, as this may indicate a serious cardiovascular condition. 10 essential strategies for a healthier life. The heart is one of the most vital organs in the body, responsible for pumping oxygen-rich blood to every tissue and organ. Keeping it strong and healthy is essential for longevity, energy, and overall well-being. Fortunately, heart disease is largely preventable by making simple yet impactful lifestyle changes. Here are 10 scientifically proven strategies to help protect your heart and enhance your overall health. 1. Engage in regular physical activity. Exercise is one of the most effective ways to strengthen your heart and improve circulation. Engaging in at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, swimming, or jogging, can help lower blood pressure, reduce cholesterol, improve heart function, and maintain a healthy weight. 2. Maintain a balanced and nutritious diet. The food you consume directly impacts your heart's health. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports cardiovascular function. It's equally important to limit processed foods, excess salt, saturated fats, and refined sugars, as these can contribute to high cholesterol, high blood pressure, and obesity, major risk factors for heart disease. 3. Manage your weight for heart health. Excess weight, particularly abdominal fat, can increase the risk of developing hypertension, type 2 diabetes, and high cholesterol, all of which put extra strain on the heart. Maintaining a healthy body weight through diet and exercise reduces this risk and supports optimal heart function. 4. Avoid smoking and exposure to secondhand smoke. Smoking is one of the leading causes of heart disease, as it damages blood vessels, reduces oxygen in the blood, and raises blood pressure. Even exposure to secondhand smoke can increase the risk of heart attacks and strokes. Quitting smoking is one of the most powerful steps you can take to improve heart health, regardless of how long you've smoked. 5. Limit alcohol consumption. Excessive alcohol intake can lead to high blood pressure, irregular heartbeats, and increased cholesterol levels. While some research suggests that moderate consumption of red wine may have cardiovascular benefits, excessive drinking puts strain on the heart. It's best to limit alcohol intake to moderate levels, 1 drink per day for women and 2 for men. 6. Manage stress for a healthier heart. Chronic stress releases hormones like cortisol and adrenaline, which can lead to high blood pressure, increased heart rate, and inflammation. Practicing stress management techniques such as meditation, deep breathing exercises, yoga, or spending time in nature can significantly reduce the negative impact of stress on heart health. 7. Prioritize quality sleep. Lack of sleep is linked to an increased risk of high blood pressure, obesity, and heart disease. Aim for 7 to 9 hours of quality sleep each night to allow your body to repair, regulate stress hormones, and maintain optimal heart function. Poor sleep can also lead to irregular heart rhythms and an increased risk of heart attacks. 8. Control diabetes to protect your heart. Diabetes is a major risk factor for heart disease, as high blood sugar levels can damage blood vessels and increase cholesterol buildup in the arteries. Properly managing diabetes through diet, exercise, medication, and regular monitoring can help reduce the likelihood of developing cardiovascular complications. 9. Monitor and regulate blood pressure. High blood pressure, hypertension, is often called the silent killer because it may not present symptoms but significantly increases the risk of heart attacks, strokes, and heart failure. Regularly checking your blood pressure and keeping it within a healthy range, below 120/80 mmHg, through lifestyle changes and medications if needed can protect your heart. 10. Schedule routine medical checkups. Regular health checkups allow for early detection of risk factors such as high cholesterol, high blood pressure, diabetes, or arrhythmias before they become serious. Seeing your doctor for annual heart screenings, blood tests, and ECGs ensures you stay ahead of potential heart problems and take proactive measures to prevent complications. Your heart is your body's powerhouse, working 24/7 to keep you alive. Unfortunately, heart disease remains the leading cause of death worldwide. But the good news is that most heart-related issues can be prevented with lifestyle modifications. By adopting a heart-friendly routine, including nutritious eating, regular exercise, stress management, and medical checkups, you can significantly reduce your risk of heart disease, enhance your energy levels, and enjoy a longer, healthier life. If you found this information valuable, don't keep it to yourself. Share this video with your family, friends, and loved ones. It could help save a life. What lifestyle changes have you made to support heart health? Let us know in the comments below. Subscribe for more essential health insights, and check out our next recommended video. Stay informed, stay healthy, stay heart smart.